Hi guys, Rachel Hippolyte here. Today I want to talk about diagnosis and the positive but also the negative effects that a diagnosis can have. So often clients that I work with often have multiple diagnoses, and they can be anything from PTSD, borderline personality disorder, chronic pain syndromes, anorexia and other eating disorders, anxiety, depression. And what's important to understand is the underlying cause of these diagnoses. And the underlying cause is a protective mechanism from the unconscious part of the brain that is based on old stories, old traumas, old memories that have happened in our past. And the positive side of having a diagnosis is often the clients that come to me have been searching for years, not understanding what's wrong with them. So that can be a massive relief in understanding that what they've been going through is very real, and all of a sudden somebody is actually listening to them. But the negative effect of having a diagnosis if we don't do something with that. So I've spoken about our identity in the past. And our identity is based on our memories, things that have happened in our past. And that then rules the behaviors, the things that we feel, the emotions that we feel, okay? So with the negative effect of a diagnosis is that we've got a label, okay? And we can actually feel good about having that diagnosis, but what then happens is the unconscious mind, that illogical part, that part that's just running in the background, actually thinks, oh, okay, I am doing a good job at protection. We've now got a diagnosis. We now know there's something wrong. And therefore it strengthens those symptoms. It strengthens that hold that the unconscious mind has on that protective mechanism. Okay, so it's really important, and this is what I want to get out of today, is that a diagnosis is important, but it's also equally as important is to use that diagnosis to know, okay, there's something wrong with the integration of things that have happened in my past, and it's something that I need to deal with to reintegrate and to release past traumas so that they no longer have an effect on my life now. And it's really important here is that it doesn't become, that diagnosis doesn't strengthen that identity. And this is what I always say, we identify not on our past, we identify on who we want to be or who we were when we were happy before this trauma happened. And that is the most important thing. We don't want to focus on who we don't want to be. We don't want to focus on those negative emotions. We don't want to focus on how our life has changed. We want to focus on who we need to be. And in order to do that, we need to release the negative effects of the trauma that has happened in our past, and then strengthen that new identity about who we need to be. I hope that makes sense, guys. It is so important. Take your diagnosis as a way of being able to move forward, to use that diagnosis to get help in order to become that person that you need to be. Please message me with any questions, any diagnosis that you may have been given and help that you are getting, or help that you're not getting. Sometimes when we get a diagnosis, we're literally just labelled and then not given a way to improve. Thanks, guys.